Have you treated many dancers, athletes, fitness instructors? I've battled with chronic pelvic pain for 5 years, and now after listening to you this evening, it's given me hope. Unfortunately, I couldn't be farther away living in Western Australia, but thought you may be able to help. I have responded positively to 3 pudendal nerve blocks with full pain relief up to 10 days each time. However, I had no long-term relief with Botox and physical therapy. After listening to you, sounds like the pain pump following Botox or block would be the next step. So yes, I actually have a lot of patients who are athletes, who are ballet dancers, who are fitness instructors, and a lot of their pain is caused not necessarily by direct injury. Of course, there are patients who, in the process of doing athletic activity, had direct injury, but in a lot of patients, it's the strengthening of the muscles of the pelvis, especially ballet dancers, gymnasts. They tend to have a very tight pelvic floor. And the pain is caused by the spasming pelvic floor muscles. So in this case, I think that your original pain was from the tightening of the pelvic floor muscles, and especially because you had the pudendal nerve block, you had some other procedures, and there was a temporary help. It is probably the pelvic floor muscles that are giving you pain. Of course, you had physical therapy and you had Botox, and you say that there was no relief. Well, what is important to ask your physical therapist is if your muscles have indeed relaxed after Botox and if they indeed have relaxed after physical therapy. I have so many patients who tell me that they have received Botox or some other botulinum toxin and yet they are still in pain. But they were actually never really examined if the pelvic muscle spasm got better. Because if the pelvic floor muscle spasm didn't get better after Botox, that means that you probably did not get enough medication. So if your muscles continue to spasm, then you probably need more Botox. Maybe you didn't get enough dose, or maybe you didn't have all the muscles that need to be injected properly. Only after you're told that your muscles are completely relaxed and you continue to have pain, then you would look for the next step, the next treatment. Here you mentioned putting the pain pump in. This is the procedure we're doing quite a lot last year, where the thin catheter was implanted next to the pudendal nerve, and we dripped local anesthetic on the nerve to desensitize the nerve and help your brain forget the centralized pain. It is the procedure that we put on hold for now, partially for the logistics reasons, and partially because me and the radiologist, we have to figure out some technical aspects of the procedure, meaning how to be able to keep the pain pump in longer so the patients have more benefit. I certainly have had patients who had pain pump, and at the time when they had pain pump, there was minimal pain, but in a lot of patients, when the pain pump came out, the pain returned. Because of the logistics reasons, meaning the locations where we do the procedures, we were not really able to do the Botox and the pain pump at the same time, and hopefully in some future this will be available. If you have truly relaxed all your pelvic floor muscles after the Botox and physical therapy, then what I would suggest for the next step is amniotic allograft. So amniotic allograft is the tissue that is obtained by the company during cesarean section from the placenta and amniotic membranes and amniotic fluid. They prepare this tissue, screen it for viruses and all the other diseases, and this can be injected next to the pudendal nerve. The amniotic allograft has very strong anti-inflammatory properties, much stronger than the steroid and much longer lasting. but it also has growth factors. And those growth factors will promote the nerve healing. That is if the nerve is not compressed. But if your pain is bilateral, if it's on both sides, and you never really had any injury after which the pain started, it is unlikely that you have a true nerve compression, and it's much more likely that you still have an untreated muscle spasm that is giving you your symptoms.